On the humanitarian issue, Israel says that they have a number of crossings open, whether from Israel itself or from Egypt, and that actually they put the onus on you and the humanitarian community. They say if you can't get it there fast enough, that's not on them.
Yes, I've heard this, and I don't find it a fair judgment. It is true, there are two entry points into Gaza, one through the Rafah crossing, the other through Kiryat Shalom, which the Israeli government has been good enough to open up to traffic, and there are good plans to increase traffic through Kiryat Shalom. But here's the point. You can maybe get trucks in, but if you cannot rely on deconfliction of access routes to people in need, if you cannot rely on hospitals not being attacked, at least nearby, if you cannot rely on people having to move from one place of insecurity to another place of insecurity, those are the issues that make humanitarian aid delivery. It's not a matter of the number of trucks that can get in, it's the access inside Gaza that include the elements of constraint. And that's where we have consistently, and my Secretary General has consistently said, it's fine and well to count the trucks going in, but the story only starts with that. It doesn't end there.
Well, just to be clear, before October 7th, 500 trucks a day were going in. Now, a maximum of 127. And US Senator Chris Van Hollen told me that he actually puts it on the Israeli authorities to get the flow moving, because as you talk about deconfliction, he said even the checking mechanism, checking the trucks, is so difficult, and, you know, they're constantly having to be sent back.
Well, there's also quite an extensive use of the dual-use category by those who are checking the trucks. And we've had quite a lot of medical and health equipment construed as dual use, and therefore the truck is sent back and not allowed in. And finally on this, and referring to your 500 trucks a day, what we all remember clearly is that 80% of Gazan sustenance prior to October the 7th was private sector. And we have argued throughout, please let private sector operate. And they can only operate in safety, of course.